Before moving to Boquete, I assumed I would have to travel frequently, at least to Panama City for quality health care. I pictured long drives, limited services, and difficulty finding providers. As a nurse, I know how important access to healthcare becomes as we get older. Many people considering Panama are retirees or approaching retirement. Healthcare isn't just another expense, it's a major part of the decision. So, of course, naturally, I had concerns. What surprised me was that healthcare access here was better than I expected. Boquete has physicians, clinics, pharmacies, dentists, laboratories, and specialists who visit the area regularly. And when higher level care is needed, David is only a short drive away. This was something I didn't fully appreciate before moving here. I thought healthcare would feel isolated. Instead, I found that many residents routinely access care in both Boquete and David. I wanted to share a small personal story about a friend who was walking in our neighborhood and a stray dog approached him and actually bit him on the bottom of his lower ankle. So he walked into a clinic to get looked at. He was able to walk in the clinic. It was in our local area in Boquete. They looked at his wound. They gave him a tetanus shot, and his total visit was $20. It was very reasonable. So this was at a public clinic, just so that you guys can have a reference of how inexpensive the care is, how quickly it can be delivered to you, and how it is very convenient to where we are here in Boquete. The biggest surprise wasn't the buildings or location, it was the cost. Coming from the United States, I was shocked by how affordable many services can be, including your doctor visits, your lab work, prescription medications, your dental care, and of course, costs vary, but many expats tell the same story. Healthcare expenses are often lower than what they experienced in the US. And as a nurse, I understand that lower cost doesn't automatically mean lower quality. And that was another pleasant surprise. What I've learned from this is that healthcare should never be an afterthought when moving abroad. Research the hospitals, research your medications, research specialists related to your personal healthcare needs. What works for one expat may not work for another. And as a nurse, I always encourage people to plan ahead rather than wait until a medical issue occurs. I also would like to make a medical disclaimer. I am a nurse, of course, but I am not your nurse, so you always want to follow up with your primary care provider about any healthcare decisions or choices you may make. So let me state this again. I was wrong about healthcare in Boquete. Yes, I expected fewer options and more limitations. But instead, I found better access, lower costs than I anticipated. That doesn't mean it's perfect by any means, but it does mean healthcare here is stronger than many people assume. If healthcare concerns are one of the reasons you're hesitant about moving to Panama, let me know in the comments. What questions do you have? And if you're new here, I'm Michelle. I'm a nurse, a wellness advocate, and an expat sharing what life is really like here in Panama. So subscribe, and I'll see you in the next video.